A grim milestone in the COVID-19 pandemic. The World Health Organization says 15 million people have died around the world. Most of those who died were in Southeast Asia, Europe, and the Americas. Here in the United States, 1 million people have died, according to data from NBC News. Johns Hopkins has the death toll at just under 1 million. This comes 27 months after the U.S. confirmed its first case. News4Jax reporter Joe McLean joins us live from UF Health. And Joe, you've been talking with medical experts about what we can take away from these figures.
Right, and we're set to hit this 1 million death milestone right at a point when most of the country has sort of gotten used to not having to think about COVID-19 every day anymore. We've mostly ditched the masks. It's safe to go without those now. We're relaxing social distancing, and everything's really starting to feel like it's getting back to normal. Well, medical experts, as I spoke to them today, say this million death milestone should serve as a reminder of the national and global impact of this pandemic. 1 million deaths in the United States have been caused by COVID-19. That's according to data from NBC News, with other virus tracking sources projecting that amount in the coming days. For perspective, that's greater than the entire population of Jacksonville. And behind each one of those million deaths is a family missing a loved one. From Levis Dasher, a beloved Duval County music teacher, to a retired Neptune Beach police officer, Eddie Bounds, to the coastal Georgia town of Riceboro's mayor, Joe Harris, and many, many others who lost battles with COVID-19 and its variants. Today, with vaccines, treatments, and much higher rates of resilience, the rate of hospitalizations has fallen to a fraction of its peak. UF's Director of Infection Prevention, Chad Nielsen, says looking back at the last 2 years, the general public and even the medical community will likely be learning from the disease and how we responded to it for years to come.
We're going to look across the spectrum of the world to see who did this better, who preserved life better, how they handled their population differently than we did, to see what are those best lessons that we can move forward.
Nielsen said those lessons will be in how we tackled the virus through vaccines and treatments, how our medical facilities and hospitals were able to handle the strain, and how governments and health departments communicated with the population to fight a disease cooperatively.
We thought we were prepared and we weren't. And so I think that's a big lesson learned for all of healthcare, all of government aid agencies and whatnot. We have a lot to do in terms of learning from what happened on the early part of this pandemic in terms of how to respond potentially to the next. And those lessons are coming.
According to Johns Hopkins University of Medicine, COVID-19 is responsible for more than 6.2 million deaths worldwide. And I want to mention a recent report from the World Health Organization that estimated the number of COVID-19 deaths as a result of the disease and as a result of, by extension, COVID-19 deaths that may have been a result of someone needing other treatment but for the overflowing hospitals. So COVID-19 and COVID-19 by extension. The World Health Organization estimates the total death toll of the disease to be 15 million around the world. Reporting live, I'm Joe McLean, Channel 4, the local station.